We're good to go?
Yeah.
We're rolling? Awesome. Do I look at you?
Yeah.
So that's what's really important. Hello everyone, my name is Gabriel.
I'm David,
I'm Cambry.
and we have Danae in the back.
Yeah, homegirl's a little sick, so we're not going to force her to stand up in front of you guys and try to project her voice today. Today, we are going to be covering the basics of cardiopulmonary respiration for adults. Resuscitation, there we go, for adults. And just as a little bit of a disclaimer, we are not certified medical professionals, right? We're not going to be able to offer you guys any kind of certification as a result of doing this. Really what we're trying to do is practice implementing a lesson plan. But we also didn't want to bore you guys with Shakespeare or like early 1700s history, if you will. Something that may actually have impact in your lives. And even with just a rudimentary knowledge of CPR and how to conduct it, you can be the difference between life and death for an individual. That being said, I believe...
Yeah, so here we have the Good Samaritan law, and basically it protects you legally if you injure the person while trying to save them in a medical emergency. For example, here we have conducting CPR to save a person's life and you accidentally crack a rib from the compressions, you would be protected under this law. So overall, just like knowing the basics of CPR, you can possibly save a life.
Awesome.
Okay, so basically what we want you to get out of this presentation is to know what the ratio of chest compressions to rescue breaths are. We want you to know how far you should press down during the compressions, when CPR should be administered, and when to place the person into the recovery position.
So what is CPR? It's cardiopulmonary resuscitation. It's a medical procedure involving repeated compressions of a patient's chest performed in an attempt to restore the blood circulation throughout the body. The true rescue breaths provide oxygen to the lungs, and once again the chest compressions keeps the blood circulating through the body. When to perform CPR? When the heart's not beating is an obvious sign of get started on CPR. Whenever someone's not breathing, someone can stop breathing or have cardiac arrest. Some of these that can stop you from breathing are heart attack, strokes, drowning, electrocution, or myocardial infarction, also known as heart attack.
Okay, so there's the ABCs, which are airways. So you check the airway to make sure that it's clear, and if it's not clear, there's like a whole nother step for that. There's breathing, so you check to see if the person is breathing, so if the chest is rising. The circulation, which you can find on the wrist or on the side of the throat, which is nearest to you. And you can check to see if their color and their temperature of their hands are normal through observation, so just by looking at it.
And also on the airway, or when you're checking for a pulse, the circulation rather, you want to do it on the side nearest to you, because if you reach over, someone could think you're choking the person, essentially, compared to doing it on this side.
So compressions, we are doing the hands only CPR, which requires 100 to 120 compressions per minute. So you place the heel of one hand on the breastbone right between the nipples. You place the heel of your other hand on top of the first hand, and you intertwine your fingers. So if you guys can all do that.
Hi guys, let's get waves.
Waves.
Let's waves.
Okay, so
There
then
we
you
go.
position your body directly over your hands, and you give 30 chest compressions.